Are we live?
We are live.
So I don't see anybody at this point, correct? Hello, everybody.
No. Hi, everybody.
My name is Brian Ray. I'm a veterinarian here in Racine, Wisconsin. I'm a 1994 Kansas State University grad. I practiced for 8 years in Las Vegas before I decided to move up here and have to worry about things like stuff that melts ice. So I've been here since 2001. I have my wife, Amy. She manages our hospital, and I have 2 teenage kids and 3 dogs. Currently no cats. So I've been asked to discuss the effects of ice melt products on our pets and what might be a better alternative, some of the things to be concerned about with particular products, what to watch for, etc. So most of the ice melt products that we're going to use are going to be a solid form. They're going to be granular in nature, and most of them are going to be different salts. Certainly the focus of this group is sodium chloride, what we would call table salt, and also a very common component or sole agent in many ice melt products. From a pet safety standpoint, as far as external irritation, it's probably one of the least irritating to skin, mouth, these kind of things. However, with all of these different products, the thing to keep in mind is casual contact, walking on it, licking it from the ground, are liable to cause mild symptoms, if any. What we're primarily concerned about with severe toxicosis is the pet having access to the bulk product. And that's going to potentially cause life-threatening clinical signs, and possibly with virtually any of them, the products, if they ingest them. So sodium chloride, we're all familiar with. The other salts that we see in ice melt products are potassium chloride, magnesium chloride, and calcium chloride would account for the overwhelming majority of products. And the reason there are different products out there is they work at different temperatures more effectively. So if we want to look at what is going to be the primary concern for our pets, which is casual contact, they're walking through it, they may lick a surface that's contaminated with it. We're going to see superficial irritation, especially of the feet. When we get into especially calcium chloride products and potassium chloride products, they're the most superficially irritating products. So you could even see ulcers in the mouth if those products are taken in a casual manner. The ASPCA lists in descending order of clinical signs with most ice melt products. Increased, if they're orally taken in, increased salivation, decreased appetite, vomiting, and diarrhea. And these symptoms tend to be self-limiting if the exposure is small. So if I had to pick a granular product to use that I would consider less irritating, less potential for catastrophic problems with a larger oral ingestion, would probably be the magnesium chloride products. They're not as superficially irritating. Potassium and calcium salts are the most irritating. Likely the most pet safe products are those that are based, they use urea as their ice melt product. And they may also contain propylene glycol, which is a common sweetener in some products. However, they may also contain ethylene glycol, which is antifreeze, which is extremely toxic to our pets. So even small ingestions of ethylene glycol are bad. So a lot of those type of products, however, are used by municipalities in a liquid form and spread on roads, as a pre-treatment. But there are if you find something that's pet safe, the likelihood is it's going to be a urea-based compound. The big warning there would be for anybody that keeps ruminants, animals that graze, that eat grass. The urea products are highly toxic to them. So if you've got goats, sheep, cows, horses, rabbits, any of those type of creatures as a pet, they shouldn't. You should keep the urea-based products away from them. So that's kind of a, well, I guess we should speak about, how to properly handle. Again, bulk ingestion is going to be the primary concern with life-threatening clinical signs. So casual contact, things to do certainly are, well, you can limit your use of these products. However, you can't dictate what your neighbors, around the block, et cetera, are going to use when you take your pet out for a walk. So when they come back in the house, wipe their feet. And ideally, I would even consider using a small bowl of water to swoosh their feet off in, just to really dilute out any product. And depending on what you've been doing, if there's been a lot of running, splashing, these kind of things, wiping your pet down, their face, their legs, their underbelly, especially where things are going to splash up on them, are a good idea. To protect their feet, if they are particularly sensitive, not only to the products in the environment, but also, just cold, dry weather exacerbated by some of these chemical products to melt ice. You can, there's something called a paw wax. So it's a product that you rub into their foot pads before they go out, and it makes a shield that helps them not get direct contact, or as direct a contact with the chemicals. Still warranted to wash their feet when they come in. Booties are a worthy consideration. Another thing that we can take from our municipal people that use ice melts is they pre-treat. Ice melt works much better if you put it down on the surface before the frozen stuff falls on it. In fact, it also makes it easier for you to move the product, and that's the prime reason municipalities use them on roads, is so there's a melted layer between the snow and the pavement that helps their plows move it off more efficiently. So if you were to pre-treat prior to a snow or ice event, you're going to remove most of the ice melt product when you clear your sidewalk. Along with the snow and slush that you scoop off. And absolutely always keep your ice melt products in a sealed container out of the pet's reach, because again, that carries the highest risk for potential problems. I think I've kind of run through the information I had prepared. I don't know if Allison can come back and possibly mediate some questions if there are any.
Yes,
and
thank you.
Tell me, did I give any good information?
You did an excellent job, Brian.
Thank you.
Yes.
So that was, quite a lot pretty fast. Any clarification needed out there?
So I did see one comment come in here from Jess Starks, and she said, "Thank you for this. This is perfect information and also important to highlight other species that a person may have." So
thank you.
Got good mark so far.
Watch out for the ones that eat the roughage. The urea products are very, very toxic to them. It's a big deal for those pets in urea based products.
All right, so yeah, let's let a few more questions come in. I do see a comment here from Marcia. Excellent presentation, exclamation point. Is walking your dog through fresh snow after walking them on pavement with salt a good way to remove it from their feet?
Yeah, likely it's going to do a pretty thorough job. And, if it's certainly going to, if it's cold enough, it's not going to melt and dilute very much, but it certainly will physically brush it off. But if you want to be particularly cautious, or that your pet has sensitive skin. One other concept that I failed to mention about a lot of these, ingestions of larger quantities. If your pet has underlying kidney problems or heart problems, especially, they are going to be much more susceptible to toxicity than a pet with normal heart and kidney function. So yes, I think if they have walked through clean snow, for I can't give you a time or a distance, but that certainly is going to be beneficial at removing some of the ice melt.
Awesome. Thank you, Brian. I don't see any other questions in the queue yet. I'll give it another minute. And as I do, I just want to take a second to give a big Saltwise shout out to our organizing sponsors today. So Brian was actually introduced to me by Nan Calvert from the Root Pike Win and other organizations that have helped make Salt Awareness Week possible are Milwaukee River Keepers, the Fox Wolf Watershed Alliance, Waukesha County, and the City of Superior. So a number of really passionate, dedicated individuals from those organizations that help make this happen and bring all of us here today.
I don't think I covered symptoms of exposure, other than the most common certainly are salivation, poor appetite, vomiting, diarrhea, and most of those with mild exposures, they're going to be self-limiting. They don't need necessarily to be addressed. However, if vomiting becomes protracted, your pet's acting weak or lethargic, obviously they need more help, and never hesitate to call us for advice on that. But I often, people ask me what to watch for, and I don't think a lot of owners are going to be attuned enough to look at and say that symptom equals this exposure, et cetera. Your pet's not doing well. Adequate reason. You suspect exposure, you're seeing any type of symptoms, adequate reason to call or make an appointment, get your pet seen. But a lot of these salt products will end up affecting, cardiac muscle, nervous system, muscular coordination. So those are symptoms oftentimes of excess exposure to sodium or potassium. Those are really magnesium potentially, but a much larger exposure. Actually, the calcium salts, while they're extremely irritating, our bodies are really poor at absorbing excess calcium. So that would have to be a weird circumstance for a pet to develop a calcium overdose problem. But definitely potassium, sodium have the potential to cause systemic illness and potentially death. 2 grams of table salt per pound of dog is a lethal dose. So what would that be? So if we took, let's say there's 15 grams of water anyway in a tablespoon, so a pretty good equivalent. So that would be, enough for a 7-pound, a tablespoon could potentially be lethal in a 7-pound dog. So I don't know anybody that wants to eat a tablespoon of salt, but there's a lot of things our pets I can't explain why they like to ingest them. And anybody that lives with cats and dogs in the same house knows what I'm talking about.
All right, Brian, it looks like we have a few more questions coming in here. Smith Christians asked, any advice for Addisonian dogs who are very well managed but love the snow and ice?
Yeah, so I live with an Addisonian poodle myself, 14 years old, diagnosed at 2, going strong. I consider them pretty normal patients if they're well managed. And actually, salt substitution is sometimes a necessity in some Addisonian patients to keep their sodium levels up, because that's one of the problems with Addison's disease is they get high potassium and low sodium because they lack a hormone from their adrenal glands to regulate that. So they might be a special situation if they ingested some of these, sodium or potassium, but the approach would be the same. I don't know necessarily. I'd have to think about that. At first flush, it doesn't worry me for casual contact or playing in the ice and snow. But if they ate a bunch of it, maybe they would have a tougher time or need more care.
All right, it looks like we've got another question here about water softener salt and thoughts about indoor pets, maybe getting into that.
Yeah, again, that's going to be they can't get to it in your water softener. So keep your bulk product out of the way. And I assume that's good old fashioned sodium chloride that goes into a water softener. So same rules apply. It's just in bigger chunks than our ice melt. And, rock salt that we use, if anybody still makes ice cream out there. Put the rock salt on the ice? No, nobody.
My friends do. I get to benefit from it. I don't have to do the work.
So yes, any form of sodium chloride, treat the same.
All right. It looks like Megan Hopefelt has a question. She says, "Hi, Dr. Ray. Great information!" Exclamation point. Do you consistently see problems arise annually with animals due to exposures to de-icers?
Excellent question. No. We have 4 veterinarians in our practice. We do see the occasional, foot pad, or actually the foot pads tend to be pretty tough. It's the tissue between the foot pads that, is more tender. We do see that. But I have not knowingly in 25 years of doing this treated significant intoxication from ice melt products. It's real. It happens. I think pretty bad reference because it was from 1998. But in that year, the ASPCA saw or took 50 phone calls on ice melt products. And among that 50, it ranged everything from a deceased pet to very mild symptoms. So it is a real threat. But it's not a common problem that we deal with. That's because y'all are doing a good job of taking care of your pets.
Okay. I feel like we've answered all the questions. You've answered all the questions that have come in so far. We do have a little shout out from Smith again. Hi to your Addisonian dog Spoo from Addisonian Spoo Robbie. I think standard poodle.
Mine's a miniature poodle named Xander.
Miniature poodle, yeah, in Madison. So.
Yeah, but poodles like Addison's disease.
I mean, I hadn't heard of that before.
Yeah, it's not a horribly common problem, but the poodles are predisposed.
And I did just want to put out there to the audience that since I started my position at Saltwise, I learned that there aren't any truth in labeling laws around de-icers. So products may say pet friendly, but that doesn't actually mean that they are. So you really do want to take a look at what's in there. And as Dr. Ray had said, trying to move away from the sodium chloride to more magnesium chloride products.
Yeah. Or urea based, as long as because the urea based ones are often combinations of things, and I would avoid anything that had ethylene glycol in it. You said something that made me have a thought and now it went away.
Okay, well, maybe it'll come back. In the meantime, John J has asked, is softened water a concern for dogs? So if they were getting that extra sodium in the water.
I don't know what the human cardiologist opinion is on soft water. I don't concern myself about it because it's hard to tell people, and I tell them don't give your pet potato chips if it has heart disease. But our more common approach is a stable sodium diet or situation. So keep everything exactly the same. We'll adjust your medications to meet your sodium intake. Now, I'm sure in people, sodium restriction is, preached, but I don't know the difference in sodium concentration in, well water versus softened water. Sorry. But no, I'm not concerned about your pet drinking softened water on a regular basis. Mine do.
And actually, we're going to have the experts on drinking water on tomorrow. So if you do have some more questions about that, you can speak with Amy Barrio from the Madison Water Utility and Kevin Masaryk from UW Stevens Point. He's a groundwater specialist. So we can take more of those questions then.
And I know modern softeners use far less salt than they used to. I know when I was a kid, as soon as I could schlep 50 pounds, it was my responsibility to deal with the softener. And I put a lot of salt in that thing. And I think some of the new ones, once or twice a year, you have to add salt. So
yeah. Was Brian, you're just a little talking commercial for Saltwise. Yeah, so Thursday we're gonna have a water softening specialist talk about some of those upgrades to water softeners that have allowed them to use far less salt. And if you want more information about water softeners and how they can be optimized, you can always check out the Saltwise website. We do have another question here about pets. Excuse me, not pets, but rabbits. So the question from Marcia is, are the urea-based products dangerous to wild rabbits?
Yes. And so any creature that uses bacteria to digest its food, urea is dangerous to. So cows and sheep and goats have rumens. They, the famous 4 stomachs. Not all of them are 4, some of them are 3. But rabbits and horses, it is the other part of their colon, that ferments their food and breaks down grass so that they can take advantage of it. But the flora that they have, you give them urea and it creates ammonia, which is extremely toxic.
When Brian is, we were getting going today. I told you I was out hiking this weekend and I saw some little rabbit pellets, which always make me think of Cocoa Puffs in the woods. And it was several years ago that I learned that rabbits, and so I'm assuming this is for domestic rabbits as well, after they eat, they'll like poop and it'll be like gooey and like partially digested, and they eat that again.
Correct.
And then discharge the little Cocoa Puffs.
Yeah, so there's I think it's nighttime stool that's passed that they re-eat.
Sorry, I'm a little diverging a little bit here.
Probably
all right.
For nutrients and to make sure their bowel stays populated with the good guys.
All right, so someone had said that their pets have been drinking softened water without problems. So
good.
That's good. I would say that softened water, and sometimes now even our drinking water that is higher in sodium and chloride, there are some concerns for people who have like predisposition to heart disease. So that is something that you might want to be aware of, as you kind of mentioned, Brian. All right, I don't see any other questions. We'll maybe just take a couple more seconds here, see if any come in on the chat, but you were pretty popular here in the question pool, Brian, and really thank you so much for sharing your expertise with us. And,
one of my classmates, whenever anyone asks him what he does for a living, he tells them he sells insurance, because nobody wants to talk to an insurance salesman. But if you tell someone you're a veterinarian, you better be ready for a conversation for a while. Then they'll gather their friends around too for more questions. We're very popular at parties, and we tell all the gross stories. All
right. Well, it looks like you're off the hook for now. But again, I just thank you so much for showing up today and giving us your time for Salt Awareness Week. And hope you enjoy the rest of your day in that beautiful sunshine out there.
Super. Hope it was useful. Thanks for inviting me, and everybody take care. Stay safe.
Bye.